Hello, I'm Roberta Lavin and I am your professor for this course. This is Chapter 3, Introduction to Nursing Research and Evidence-Based Practice. Let's begin by going over the learning objectives for the chapter. We will discuss the importance of nursing research, discuss the importance of evidence-based practice, explain the difference between research and evidence-based practice, describe a minimum of 3 roles nurses play in research, define a systematic scoping and integrate reviews, and explain how to write a PICO question. As a nurse, it is essential to develop the skills necessary to participate in research consistent with the scientific method, which is based on verifiable observation as a measure of acquiring knowledge through careful observation, formulating hypotheses, experiments, measurement, and data analysis. No matter a person's role in nursing, administrative, clinical, practice, education, policy, or research, nurses will identify problems and gaps in knowledge and practice that need scientific examination. Using research successfully requires that nurses be able to make a judgment on the appropriateness of the methods used and whether the analysis reflects the data presented. In order to do this, the nurse must understand and be able to apply the basics of scientific method as a system of acquiring knowledge. You will notice that the graphic lays out what the basics of applying scientific method are: defining the question, gathering information, forming a hypothesis, testing the hypothesis, analyzing the data, interpreting the data, publishing the results, and you can then retest and start all over if you wish. The last 160 years have seen an exponential growth in nursing research and research paradigms, theories, methodologies, and tools of research. The toolbox of the novice researcher today is more complex than all the tools that were available to people in 1900. The complexity means that nurses today need to understand not only the history and the time research was conducted, but also understand how to use the basic tools available today, as it is impossible to read current research without the current understanding. If you think back to the time of the Crimean War and Florence Nightingale, it was only the beginning of the use of statistics to estimate high mortality rates and what might be the cause. The early part of the 1900s was a time of women's empowerment and the suffragettes, and much of the focus of nursing research was on nursing education and was influenced by the Goldmark report that came out of Yale University. The Goldmark report. As a result, Yale University created the first university-based nursing program. And Lillian Wald promoted community health and worked to decrease infant mortality. In 1900, the American Journal of Nursing began as the first nursing journal. There was rapid expansion, and the Great Depression and World War II brought on the Cadet Nursing Corps, and the result of nurses being officers in the uniformed services. And then significant advancements in nursing research occurred. There were rapid advancements in nursing research from 1950 to 1989. University education expanded, and research institutes of nursing organized, like the National League for Nursing Research, was established. We then got the National Center for Nursing Research at the National Institutes of Health in only 1986. Of course, the advent of computers and the power of the computer in the 1990s brought rapid expansion of information, and it was easily accessible to everyone. None of you in this class will probably recall having ever had to go to a library and use a card catalog and search for articles, or go to the library stacks and pull journals and just look through page by page to try to find what you were looking for. Now, everything is at the touch of a finger. Today, the NIR, the National Institute of Nursing Research, has continued to grow and impact nursing research. Now is the time to get the research into practice, which is why there is a focus on evidence-based practice and literature reviews that synthesize the research findings, integrative, systematic, and scoping. There has been a move toward human-centered approaches to research, addressing health disparities, reducing structural inequalities, and improving the quality of life. Another reason that nurses need to be involved in research is that the ANA Code of Ethics states that the nurse, in all roles and settings, advances the profession through research and scholarly inquiry. All nurses must participate in the advancement of the profession through knowledge development, evaluation, dissemination, and application to practice. We do this in many ways: reading scholarly work, participating in journal clubs, or attending grand rounds or other research presentations, proposing research or evidence-based practice projects in our clinical, education, community, or policy setting, serving as a member of a research team, and that can include data collection, participant recruitment, or even project management, performing a literature review and disseminating the findings, or using it as the basis to propose an evidence-based practice project, and then assisting with grant writing. The research process has essentially 7 steps, and some people put these in, use different terminology for the same thing, but these are the essential 7 steps. First, you define the research problem. Then you review the literature. You formulate the hypothesis. You select the research design. You collect data. You analyze the data. And you interpret and disseminate findings. Literature reviews are an important step. The literature review should include a search of the existing systematic, meta-analysis, integrative, and Cochrane reviews on a topic. The minimum sources nurses should search, in my opinion, are CINAHL, PubMed, and the Cochrane Library, though there are many sources, and the sources that you use are highly dependent on the type of research you're doing. I highly suggest that you always consult a librarian when you're doing your research. There is nobody better at searching than librarians. Also, in your course online, you will notice that I posted an entire section where the librarian has provided me resources to share with you. Those come directly from the librarian that is assigned to the College of Nursing. You want to know in your literature reviews if there are any current high-quality reviews within the last 5 years. It may not be necessary to look further if somebody's already done the work for you. And if there are no existing reviews, then the first step should be to complete a systematic, scoping, or integrative review. These will be discussed in great detail later in the semester. We will discuss integrative reviews in greater detail, specifically because you will be working on a mini integrative review. There is an entire section posted online for you on doing integrative reviews and an explanation of those. In nursing, we used evidence-based practice for decision-making and problem-solving. This is based on the nurse's clinical experience, patient preference, and values and best evidence. We must then be able to identify the best available evidence. This is considered primary studies that have been peer reviewed to see if the evidence is sufficient. When we engage in evidence-based practice, we begin with a well-worked clinical question. Your textbook uses the question, is fish oil enhanced nutritional supplement effective in stabilizing weight in cancer patients with cachexia? You may identify good questions by using the PICO question. P is the population or patients you want to study. I is the intervention. C is the comparison. And O is the outcome. Please review your textbook to see a very detailed explanation and examples of PICO questions, as well as information posted online in your course. If you review the figure attached in the slide, you can see the hierarchy of evidence. Some people put this into a pyramid, and I thought it might be easier for you to look at as levels. The top level is a Cochrane systematic review, and then other systematic reviews and meta-analysis of randomized controlled trials. It goes from there down to guidelines that have been critically appraised, randomized controlled trials, systematic reviews of cohort studies, case control studies, surveys, and it goes down. You will notice qualitative studies are fairly low at level 7, and internal evidence and expert opinion and editorials are at 8, and the bottom is animal and laboratory studies and mechanistic studies. So when you are reviewing evidence for your own research or for evidence-based practice, you need to understand the levels of evidence. To do this, you must be able to read and understand the research articles. It isn't always easy, but it is a skill that absolutely every nurse needs. Let's talk a little bit about systematic reviews. Systematic reviews were the top level of evidence. A systematic review is a summation and assessment of a group of research studies that test similar questions. It's based on a clear clinical or research question. A detailed plan has to include what your search strategy is and appraisal of a group of studies related to the question. A meta-analysis is a summary of a number of studies focused on one question or topic and that use a specific statistical methodology to synthesize the findings in order to draw conclusions about the area of focus. An integrative review is a focused review and synthesis of research or theoretical literature in a particular focus area and includes specific steps of literature integration and synthesis without statistical analysis. It can include both quantitative and qualitative articles. Now this is important. How do you tell if a study is quantitative or qualitative? I'm going to be asking you to do this as I ask you to review papers throughout the semester. There will be times I ask for qualitative studies. Those are studies that may have no tables and only demographic tables telling you things like how many participants were male, female, intergender, etc. Or they may be quantitative studies, and there will be time I will say I want you to get quantitative studies. These generally have multiple tables that are more than demographics, and they have statistics. And I'm sure you came up with many others. The scientific method and quantitative research. This is important. In this course, I want you to clearly understand the difference between quantitative and qualitative research. Here we begin with quantitative research. Let's begin with a few definitions. The scientific method is orderly procedures to gather primarily quantitative information. It is systematic and a rigorous attempt to limit bias. Empirical research is when evidence is rooted in objective reality rather than personal belief. It is what we can observe, thus it is based in empirical evidence. We then gain knowledge through direct and indirect observation. Quantitative researchers gather empirical evidence using a traditional scientific method that is systematic and uses instruments to collect information. They want their research to be generalizable. Generalizability is the ability to generalize the findings to people that are not part of the study. The people doing studies for a new medication want to be able to say it will work for most people in the same way it did for those that participate in the research study. It isn't enough to know, for example, the COVID vaccine works on the people in the study, but researchers want to be able to say it is generalizable to the masses, or equally effective for most people of the same age, for example. One of the problems with quantitative research in nursing is that we deal with the whole person and not just a part of a person. It can be complicated and messy, and I'm sure you know that every day on your clinical unit. What I can do in a lab looking at one thing, blood pressure for example, I can't recreate in real life because the person's exposed to all manner of things that don't happen in a well-controlled lab. Let me give you an example. In a well-controlled lab, you have equipment that is just for that experience, that research. It's calibrated on a regular basis. You go in, and before you do the study, you're making sure that everything's working and great, and there's nobody coming in to interrupt you. Now, I'm in the ER, right? And in the ER, I come in. The person doesn't know who's going to be walking in. So it's not a participant in your research you've pre-screened and know everything about. No, this is the random person that walks in off the street. You know what their chief complaint is that they came in for. But while they're giving you their chief complaint in the ER, you have 10 other people waiting. Now, some of those people that came in are probably there and they've been using some type of illicit substance that they shouldn't have been using. So what they may or may not tell you may not be accurate. You're distracted by them. You have a person in another room that's seriously ill and there are all kinds of machines beeping and making noise. You are only divided by curtains and open areas, so you know that there's lots of noise and everything around, even though there's doors, they're not always closed. And there are people coming and going, asking you for things that may not be related to what you're doing. And while you're experiencing all of this and it's impacting what you're doing with that patient, the patient is also experiencing all of that. It is not the controlled environment of the lab. As nurses, we work in that environment. We do not work in a controlled one. And it's always important to keep that in mind. Evidence-based practice process is similar to the research process. It has 5 steps. And like the research process, different places use this with different terminology, but it is the same process. First, you ask an answerable question. You review the literature You critically appraise the evidence. You implement the practice change consistent with your clinical experience and patient performance, and you evaluate the evidence. Let's take a look at these side by side using somewhat different language and see if this makes sense to you. What is your burning clinical question that you want to know? And then how do you collect the relevant and best evidence? Well, often in evidence-based practice, this is your literature review. You critically appraise and look at that evidence. You integrate all the evidence with one's clinical experience, patient preferences, and values in making practice decisions or change, and then you evaluate to see how well the decision worked. In the research process, you actually identify an area of interest or a phenomenon of interest, and then you formulate your research question. Once you have formulated your research question, you then do your review of the literature. Frequently for research, you're looking for other studies that have been done related to the same or very similar question. Sometimes this will be in the same population and sometimes in a different one. You select the conceptual model you want to use. You choose a research design. You obtain IRB approval. You collect and analyze the data, interpret results, and communicate the findings. In essence, these are very similar processes. The real difference is that one involves original research, and the original research is to create new knowledge. We have finished Chapter 3. I hope you join me for office hours, and especially if you have any difficulty creating your own PICO question. I would be happy to talk to you about it and to walk you through it. Thank you.